Hi, I'm Dr. David Hill, and today we're going to be talking about home remedy for cough in infants. Now, the first thing I'll say here right now is not every infant should get a home remedy for the cough. Some coughs are really worrisome to me. How do I know which ones those are? Well, a cough that's accompanied by signs of shortness of breath always bothers me, especially in an infant who could be at very high risk for pneumonia, RSV, asthma, or other really serious lung disease. What does that look like? Well, if the baby's breathing fast, more than 40 times in a 1-minute period, I get worried. If it's over 60 times, I get really worried because those babies are unlikely to be able to eat and drink adequately to avoid dehydration. Likewise, if I see the skin pulling over the top of the rib cage here, or under the rib cage, or between the ribs, I get very concerned there as well. If you see your baby's abdomen crunching up with every breath, if you hear a sort of a grunting sound with every breath, or if you see the nose flaring with every breath, those are all signs of respiratory distress. That infant needs to be evaluated emergently for the possibility of serious lung disease. Now, say your infant is coughing and none of that is going on. My next question, are these coughing spells so prolonged that your infant is throwing up or changing colors, especially blue? That obviously is a bad thing. We're seeing more and more pertussis in infants and children, and that's an infant I would want to see. What if your infant just has a cold and a regular cough? Well, here's the good news. A humidifier is fantastic. Also, in infancy, I would use something sweet like Karo syrup, not honey, because honey can contain botulism, and that can be deadly to an infant. But you can use a commercially prepared corn syrup preparation that's not going to have the botulism, and it is going to be safe. If your baby is coughing more than 3 weeks, that's abnormal, and he or she should be seen as well. Talking about how to treat the symptom of cough in infants at home, I'm Dr. David Hill.